Hi, I'm Dr. Singhania, and I'm going to be talking about the clinical picture seen in the autism spectrum disorder. The concept of autism has changed vastly since it was described in 1944, and we now know there's a wide range of abilities from those who are severely affected and nonverbal to those who can be in mainstream schools and even universities. Many children present maybe as behavior problems or language problems, and some of them can be very able educationally, especially in the first few years of school, but they have real comprehension problems. Now, this is a poetry verse written by Donna Williams. She's one of the high functioning Asperger or autism women. Started speaking after the age of 4, and she's written 9 books. And as you can see, she was very intelligent. Temple Grandin has made history. She also did not speak till the age of 4. Her mother was told that she needs to be put in the institution and that she'll never speak again. Her mother did not give up and worked with her very hard. Temple Grandin has now got a PhD from animal science. She's a professor and she's a billionaire in her own right. So what are the main areas which are affected by autism? Basically, it's a social and communication disorder. And social impairment may be, lack of interest in people, or they may be interested, but they may not be able to make friends. They may be socially awkward. In fact, you have children who are aloof. You can have children who are passive, but can be drawn out. And you can have children who are socially active, but odd. They are awkward. They don't know how to interact. And of course, they may be very gullible and naive. Language impairment is part of the communication problem, and some children of course never speak, but some of them who do speak may have a monotonous voice. They may use formal and pedantic language. Pronoun reversal is a very common feature, which is instead of saying I want, they will parrot you want, and it's typically seen in some children with autism. They also use or imitate chunks of language they've heard on television, and some of them actually like talking in a cartoon voice, or some of them speak with an American accent even though they've never been to the state, and all this is because of imitating television. Apart from language, they have communication problems, and so they may have words but still they cannot communicate. They may have large number of words but they don't use them to get what they want. They may have problems with gestures, with a lack of eye contact and understanding what other people want. They have imaginative impairment and repetitive behaviors, so their language is very literal and concrete. They don't understand abstract thought, things like hide or wish or after, before. These kind of things are quite hard for them, and that's why they prefer routine. They want things in the same order. This is usually because they have difficulty with event horizon. That means they don't see the end of the event, so they cannot plan or imagine what is going to happen next. Some of them may have sensory integration dysfunction, so they're choosy in their food liking. They may not like certain textures, or they may not like to be touched. And some of them have actually fine motor problems, and they may be clumsy. This is the Triad of Impairments written by Wing and Gould in 1979. So social interaction, social communication, imagination, play, and flexible behavior. So when we say reduce social interaction, the child will not look when called. They don't respond to their name. They may not smile back at you when you smile at them. They don't like to share things. So they don't offer to show you things or wave bye-bye. They do not look at what you're pointing at. So that means they're not able to share interests. They don't call out to you, even if they say mama, baba, and they don't check to see if the parent is watching them. They have reduced social communication, means they don't have ways of letting you know what they want. So they don't look back at what they want. There is one typical behavior seen in children. When they point at something, then they look back at the parent and then back at the desired object. And this is not seen in many of these children. They can't use gestures for saying yes, like nodding, or saying no for shaking. They cannot give information. They can't tell you when they are hurt or how they got hurt, especially if you meet them after the fact. They don't like to join in conversation, and even if they do, it's very one-sided, and they have great difficulty in asking and answering questions. They have problems with social imagination, play, and flexible behavior. So they play the same way with the toys. And many of them cannot play with symbolic toys. Symbolic toys, language is symbolic. So symbolic toys are those small toys which represent real life, like dolls and dollhouse furniture and things like that. And they don't really know how to play with these kind of toys. If their routine is changed, they become very distressed and they need to follow certain rituals and routine very strictly. They may react with distress to some routine sounds because they're very hypersensitive to sound. And like I said, they have problems with event horizon. Now, the autism spectrum disorders is a wide range of disorders. You can have the typical autistic disorder. You have the Asperger's disorder, where the child or the adult speaks fluently and only has social problems. You can have the childhood disintegrative disorder, where the child regresses and it is progressive. You can have Rett's disorder, seen mostly in girls, and they also have problems with their hand movements. And you have the pervasive developmental disorder, not otherwise specified. So you can see the umbrella includes many of the different kinds of clinical pictures. This is just the list of things. The autistic disorder, which impairs social interaction and communication, and they also have stereotypical behaviors. The PDD, which is less serious, it's the mild form of autism. Then there is the Asperger, like I said before. There's high functioning autism. That means they have speech, social and cognitive deficits, but they are better adapted to the environment. They're not so rigid and they appear to have milder problems. Of course, like we talked about, Rett syndrome is genetic. You can do a blood test to diagnose it, and they have profound impairment in the use of their hands. And like I said, the childhood disintegrative disorder, which is progressive, and child loses all the skills acquired after the age of 3 or 4. It's important to know that even in mild autism, the difficulties are real. You have children who may be doing very well academically, but who have difficulties in social behavior, in following group norms. They may have problems just sitting in the class because it's too noisy for them or not structured enough. And we know that most education is in verbal. We don't use actual concrete things to teach. And then these kids can have real comprehension problems. They may have difficulty with imitation, shared attention, and the most important thing is direct and explicit teaching increases understanding. And that's why early diagnosis is really the key. Another thing which can confuse the picture are comorbid conditions. We know now that there are many physical problems involved with autism, like dysbiosis or the bowel disorder, where they may have constipation, diarrhea, food allergies. They have neuroinflammatory disorder, that means certain toxins and all can cause the brain to dysfunction. They can have epilepsy, immune disorders, motor clumsiness, sensory problems, Tourette, which is associated with epilepsy. And of course, you can have mood disorders like bipolar disorder. I've seen a lot of these children suffer from anxiety, depression, OCD, attention deficit. And of course, though 40% may have normal intelligence, there are a large chunk of children with autism who are intellectually deficient, either mild, moderate, or severe. Just want to talk to you about this little girl because just to show you how different the clinical picture can be. She spoke quite a lot. She spoke fluently apparently, but she couldn't answer the teacher or questions like what is your name. She was very hyperactive in class. She called the teacher a monkey. She would tip over dustbins. She wasn't able to follow orders and instructions, and she couldn't really interact with the kids. She could read and write, but it was very difficult for her to do anything without help. She liked children, but they rejected her because she really didn't know how to interact with them. And she spent a lot of time looking at science books belonging to her sister. Jordan was a 3.5-year-old Australian child. She looked very affectionate and she had language delay. But interestingly, she had over 200 words and she had words like delicious, beautiful, flower. But again, she could not answer simple questions like what is your name, where is mommy. She actually enjoyed hugs and was very affectionate. But in the classroom, she would sit under the desk. She would insist on wearing one purple dress. She could not interact with her peers and she was very bright, but she had pragmatic difficulties and high functioning autism. This little boy was very interesting. He came to me because he refused to go to school. He had some language problems and rigid and repetitive behavior. He was bilingual, and going to an English medium school. So the parents and the school thought it was because of that his language difficulties was because he was a bilingual child. Assessment showed deficient verbal intelligence, average performance intelligence. His language age was at around 3 years. Comprehension was worse. And I just want you to see these pictures. As you can see, he could do math, he could do matching as in English, reading, he could write words, he could do Arabic, he could do French, but this child had great difficulty with understanding simple questions. He had difficulty making conversation, he had difficulty answering things like, why do you wash your hands? So as you can see, there are people with severe problems, people with mild problems, but all of them need to be diagnosed early and helped as soon as possible. Thank you.